Hello, I'm Choon, Associate Professor at the Clinical School in Johor Bahru, Monash University, Malaysia. I'm presenting the results of our study that investigated the epidemiology of psoriasis in Johor Bahru, Malaysia. Psoriasis is a genetically determined systemic immune-mediated inflammatory disease which causes as much disability as other major medical diseases. Reliable data on the epidemiology of psoriasis is necessary for healthcare planning, but there are no population-based epidemiological data on psoriasis in Southeast Asia, including Malaysia. Hence, we performed this study to look at trends in the incidence and prevalence of psoriasis over an 11-year period from 2010 to 2020 in our multi-ethnic Malaysian population. We also look for variation in the prevalence and incidence of psoriasis by sex, age, and ethnicity. This is a population-based cohort study using routinely captured electronic health data in TeleprimaryCare clinical information system, which capture primary and secondary care data on both healthy individuals seeking routine medical examination as well as a health-seeking individual attending medical care for diagnosed condition. TPCâ holds data for about 98% of the estimated Johor Bahru population of 1.7 million. Psoriasis identified by diagnostic code were validated by dermatologists. We saw a steady increase in the annual prevalence of psoriasis between 2010 and 2020 from 0.27 to 0.51%. This increasing trend in psoriasis prevalence was observed across the different sex, age, and ethnic groups. Annual prevalence was consistently higher in males than females. The period prevalence rate was 0.34% and was higher in males than female. Prevalence was highest in Indian, followed by Chinese and then Malay. The period incidence rate was 34.2 per 100,000 person year. The incidence rates of psoriasis increased steadily between 2010 and 2020 from 27.8 to 60.9 per 100,000 person year. Annual incidence was consistently higher in males than females, and the incidence rate from 2010 to 2020 were consistently highest among Indian, followed by Chinese and Malay. However, between 2013 and 2017, rates in Chinese and Malays overlap. Overall, psoriasis was significantly more common in males than females and in Indians and Chinese than Malays. Indians were also significantly more likely to have psoriasis than Chinese. We saw a modest bimodal trend in age of psoriasis onset, with the first peak at 20 to 29 and the second peak at 50 to 59 years of age. Mean age of psoriasis onset was 39.8 years, and onset was significantly earlier in females than males and in Indian and Malay than Chinese. In conclusion, we found increasing prevalence and incidence of psoriasis with sex, age, and ethnic variation in Johor Bahru, Malaysia. This is the first population-based epidemiological study of psoriasis in Southeast Asia, adding valuable information to the global efforts to describe the epidemiology of psoriasis. The burden of psoriasis is documented for the first time in Malays, the predominant ethnic group in Malaysia, who are also major inhabitants of certain parts of Indonesia, southern Thailand, Brunei, and Singapore. These findings have important implications for healthcare planning, resource allocation, and management of patients with psoriasis in Malaysia. With that, thank you for your attention.